Hey guys and gals, this is Rick MacDermid once again with Senior Solutions Group, and thank you for checking out this video. And if you haven't done so already and would like to, feel free to subscribe to our YouTube channel so we can get the word out to as many people that would benefit from these videos as possible. We're always trying to educate and inform you, so that is the main objective. We're not trying to sell insurance, and that gets me to something that kind of makes my blood boil quite a bit, quite often. I often talk to people who are referred to us by friends and family members, or from people who find us online, find us on YouTube, who have questions about how do I get the most benefits from my Medicare for the least amount of dollars. And it's not a one-size-fits-all solution. Often, if you were to call a call center like these ads you see on TV, you might get someone who is trained only to sell Medicare Advantage. And what's Medicare Advantage? Well, that's a privatization of Medicare where you deactivate your Medicare card. And those plans are attractive for some people, but they're not the most suitable plan for everyone. It really depends on your situation. If you're looking at the full picture, what we do is we help educate you on both sides: Medicare, how Medicare works, how to sign up for Medicare, how to evaluate whether Medicare Advantage is an option for you or whether original Medicare is the best option for you. And if you decide that original Medicare is the best option, in other words, you want to go to any doctor that takes Medicare, you don't want to deal with prior authorizations or referrals, and you want the least amount of money out of your pocket if your health changes. Because when you look at this, you can't look at just your health today, because we all know people who've been healthy one day and then the next thing you know, they have a whole slew of health issues. So if you want to protect yourself, the purpose of insurance is to protect just in case. So for some of you, you might say, well, I've never been to the doctor. I hardly ever go. I haven't been to the doctor in 5, 10, 15 years. Well, you might be tempted to pick the cheapest plan possible or the cheapest Medicare Supplement plan possible. But you would possibly be doing yourself a grave disservice if you look at it that way. You have to look at your potential out-of-pocket costs and what could happen down the road, because you may not be able to switch plans later on when your health has changed. So today I'm going to focus on a specific plan, actually two plans, Plan G and Plan N. So often what happens is I get a call from someone that they were referred to us or they found us, like I said, and they either signed up or are getting ready to sign up for Plan G. Plan G right now is, for most states, still the most popular plan. But for our practice, we've moved away from Plan G because the rates are going up at a higher rate and they're higher to begin with. So typically in our state, a Plan G might cost around $200 a month on top of the Medicare Part B premium, which for most people is $170.10 a month based on the average income. If you have a higher income, you might pay more than that, sometimes way more than that. If you have a very low income, you may qualify for Medicaid and you may not need a Medicare Supplement Plan. But for those of you who are like most people, who are on Medicare, you're paying $170.10 a month. Adding Plan G on top of that's going to increase the amount you pay to about $370 a month per person, times 2 if you're married. So that's about $740 a month before you've bought any prescription coverage, which can be another $7, $10, $15, $20 or more per month, per person per month. That doesn't include your co-pays and your deductibles for your prescriptions as well. So if you were to select Plan G, again, that's a very popular plan. The great thing about Plan G is you pay zero copay once you've met your deductible, which in 2022 is $233. So with Plan G, you don't have to pay any out-of-pocket cost after you've met your deductible. As long as you go to a doctor that accepts Medicare and they bill Medicare and Medicare pays their portion, by law, Medicare Plan G is going to pay the rest of your claims for the rest of the year for all of your medical visits for hospitals and doctors. So with Plan G, you're not going to get any of the extras like dental or vision. It's only going to cover the meat and potatoes of what Medicare covers, hospitals and doctors. For many, many, many people, that's the most important thing. So keep the most important thing the most important thing. Your medical care is going to be covered fantastically by Plan G. But what if you could get almost the same benefits for a lot less money? In today's climate, with inflation, with Medicare costs going up, what if you could save money, whether you've been on Medicare for a number of years now, if you're brand new to Medicare, what if you can get almost the same coverage and save a lot of money? Well, under Plan N, in our state, you can save $40, $50, $60, maybe $70 a month, moving from Plan G to Plan N. So it's almost like a shift in thinking, because a lot of these agents, either they're not trained or they're possibly looking for the highest commission with Plan G. Well, you got to get Plan G. Okay, that's it. Okay, sign up for Plan G. They don't even give you the option of looking at Plan N. What is Plan N? Well, back in 2010, Medicare, CMS, created Plan N. And it's somewhat like a hybrid between Medicare Advantage and a Medicare Supplement Plan F or Plan G. Plan F is the old plan that has been discontinued since 2010. Now, those of you who are on Medicare prior to 2020 can still get Plan F. With Plan F, you don't even pay the deductible. It pays 100% from day one. Plan N is like Plan G, except with Plan N, you still pay 100% of the deductible. In other words, you pay that $233 deductible once a year, just like you do on Plan G. But after that, you pay a maximum of $20 when you go to a doctor appointment. So if you go to a specialist or a primary care physician, the most they can bill you, guaranteed for the rest of your life, is never more than $20. We've had a lot of clients tell us, well, the doctor only charged me $10 or $8 or even $0. But we've never had anyone call and say they had to pay more than $20. As long as Medicare pays their portion, the most you could pay is $20, or $50 if you go to the emergency room and you're sent home that same day or that same night. If you're admitted to the hospital under Plan N, guess what? You pay $0 for your ER visit and your hospital stay. So that's very important. Now, if you're going to the hospital, there is a chance you might be kept overnight for a night or maybe 2 nights, maybe even 3 nights for observation, and you're not admitted by the doctor. So if that's the case, all of your expenses would be covered by Plan B or Part B of Medicare. Part B pays 20% or pays 80%, you pay 20% of the bill if you don't have Plan G or Plan N or a Plan F Medicare Supplement Plan. If you have Plan N or Plan G, you still pay $0 for your hospital stay if you're not admitted. So the only other difference between Plan N and Plan G, and this is what these agents will use often to scare you from Plan N, is excess charges. What are excess charges? Under Medicare CMS law, if a doctor partially opts out of Medicare, in other words, they only partially accept Medicare, they can bill you for 15% above what Medicare approves on that procedure or that visit. So nationally, there's about 2% of doctors that do this. So typically, I know there's a couple insurance companies that have done studies. They've found that only certain doctors, maybe podiatrists, psychiatrists, or psychologists, charge excess fees. Maybe plastic surgeons. Some of these hoity-toity specialists in big cities like LA, Miami, New York may charge excess fees. By and large, most doctors, your family doctors, aren't going to charge excess fees. Heart surgeons typically aren't going to charge excess fees. Cancer doctors aren't going to charge excess fees. You can check with your doctor, or you can go to Medicare.gov, look up your doctor to see if they charge excess fees. So if that's the only big difference between Plan G and Plan N, is these excess fees, and only 2% of doctors nationwide charge excess fees. Most people under Plan N are never going to see an excess fee. It's like finding a needle in a haystack. So if we were to compare plans in the rates between Plan G and Plan N, we have a lookup tool that we can look. Well, here are all the companies in our state in Washington which offer Plan G. So we can see we have these different companies, USAA, Regents. We can look at their history, their rate increase history, how many lives they have covered. So we can compare not only the premium, but their track record for each of these carriers. You can see some of these companies are just under $200 a month. Some of them are right at $200 a month. State Farm just had a big increase. So for years and years, they were the least expensive Plan G in our state. They took a 29.4% rate increase this year alone. You can only get a State Farm Plan G from a State Farm agent. So if you go to a State Farm agent, their hands are tied, unlike our agency where we're not captive. So a captive agent can only sell their company. So a State Farm agent can only sell State Farm policies. Where we can't sell State Farm, but we can sell most of the other carriers such as AARP, Mutual of Omaha, Cigna, Aetna, just to name a few, Humana. So these carriers, we can look at their rates, we can look at their rate history. So if you want to pay $226 a month, you can under Plan G, or you could look at Plan N and get it for a lot less per month. So for example, $139.78 versus $226. That's $100 difference almost. If you multiply that by 2, that's about $200 a month per household that you would save each and every month. Geez, I think you could find some ways that you can use that extra $200 a month, like maybe putting gas in your car for one. So one trip to the gas pump could be close to $80 or more for each refill. So that could help you tremendously when you're looking at these plans. That's a great way to save money. And we haven't even talked about how you can save money on your prescriptions. That's another video. But if you haven't considered Plan N, feel free to reach out to us at Senior Solutions Group. We would love to talk to you because a lot of people have never even heard about Plan N. Well, I never heard about Plan N. My agent never told me, or the person at the call center never even told me about it. Or they only told me about Medicare Advantage. We can talk about Medicare Advantage as well, but if you want both sides of the story, that's what we do. And not only today, but in the future, we have reached out to our clients on a daily basis over the last several years to help our current clients save money. So if you're a current client and you haven't heard from us, give us a call as well. We're here for you. We want to review your plan. SeniorSolutions.net. 509-494-4288. Thank you so much and have a great rest of your day.